Developing now, more alarms being raised over possible cuts to Medicaid. Opponents of President Donald Trump's spending bill say it would have far-reaching negative impacts here in Nebraska.
Today, a group of experts and advocates laying out what will happen if the bill becomes law. Channel 8's Danielle Da Silva listened to the meeting and joins us in studio. Danielle?
This bill was dubbed the big, beautiful bill by Trump and congressional Republicans, but the people at the meeting say it would be harmful to the most vulnerable Nebraskans.
Speakers ranging from a former Medicaid administrator, state senator, to professor of policy, painting a picture of what they see as a devastation after cuts.
And Republicans in the House and Senate are pushing forth legislation that would undo 15 years of progress. I have spoken to people and providers across every corner of this country who know firsthand how devastating these cuts would be.
She says 16 million Americans would lose essential benefits like the 40% of labor and deliveries the programs cover, also mentioning aid to disabled patients and seniors. Senator Kavanaugh states vulnerable communities would be affected the most, including seniors losing care and people in low-income circumstances.
Unfortunately, our balanced budget is only balanced on paper, and it does not take into account any of the proposed changes to Medicaid, Medicare, SNAP, child care eligibility.
She says 55,000 vulnerable Nebraskans could lose coverage, describing it as a question of morals.
Cutting tax incentives for wealthy, we cut safety nets for families. And this notion that we require such a stringent level of oversight of those who are receiving these government subsidies, if they're receiving them to take care of vulnerable populations, to penalize them with paperwork.
David Palm is an associate professor and director of the Center of Health Policy at UNMC. He spoke about the proposed goal of reducing Medicare by $800 to $880 billion.
So we don't know exactly where the Medicaid cuts are going to come from in terms of policy changes, but there are still a lot of policy options out there to make cuts. So,
highlighting a tedious process for re-enrollment as a ripple effect. With the session just ending weeks ago, Senator Kavanaugh says no one cares about the cuts now because it's viewed as a future problem.
I do not exaggerate when I say that there is no response.
Senate Republicans are trying to pass the bill quickly as the president wants it on his desk by July 4th.